Hi, my name is Ashton James, and I'm going to go through my final e-portfolio for the Capstone course. It's got a summary of a lot of the content that we have covered in OT school here. So I left this section, the table of contents, at the very beginning. You can see down at the bottom, I've got the tabs of all the chapter names, and they are color coordinated based off the book. So Radomski being highlighted in blue, Pedretti in green, and the other chapters, both SAMS and Therapy Ed, in orange. This final portfolio is also uploaded to my Google Drive folder. I specifically chose to upload it to Google Drive because that way I can access it from anywhere at any time, and it can be useful as a study tool, not only in my fieldwork and preparation for the NBCOT exam, but also in my career as an occupational therapist, especially as a new grad beginning my career. So I'm going to go through each one of the concept maps that I have here, and I kept them in the same order as this table of contents because the content was grouped together based off of subtopic. So you can see like cognition chapters and vision chapters. So beginning with Therapy Ed 1, this covers the OTR exam and becoming certified. We've got the credentialing agencies, the certification exam content and format, certification exam procedures, what to expect on examination day. So this will be helpful very soon. After the examination, what to expect, waiting on our scores and certification. SAMS Chapter 4 and 5 breaks down both the OTPF and frames of reference. SAMS Chapter 4 being the OTPF. We've got up here at the top information about the WHO and the International Classification of Functioning Disability and Health document. And then it breaks down the same way the OTPF breaks down the domain and process being evaluation, intervention, and targeting of outcomes, and the 5 domains of the OTPF. We've also got specific occupational therapy terms. On the frames of reference side, I started with the difference in the model and frame of reference. I like the way my classmates put that there. That will be helpful as a tool. And I decided to keep the frames of reference in alphabetical order here because that will make them easier to reference in the future. Quick reference with them being in that alphabetical order. So we've got things from rehabilitative to sensory integration to PEOP, occupational adaptation model. SAMS Chapter 15 moves on to goal writing. For this one, I combined a couple of my classmates' concept maps to highlight what resources I thought would be most beneficial. Things such as goal writing tips, independence levels, prompt cue hierarchy, patient education, using the COPM to guide OT process, which the COPM we used extensively throughout our program. We've got goal directions, role delineation, goal formats here. So we use the SMART a lot throughout school. However, I also learned on my fieldwork that I really like the COAST format. Goal specifics, and again back up to independence levels. SAMS Chapter 17 is documenting ongoing intervention, so we've got a couple areas of documentation here. Role delineation again, contact notes are covered here, progress notes, Medicare compliance, photographic and video documentation, things such as attendance logs and progress flow sheets are all covered in this map. Radomski 12 is broken down in more of a left to right format, and we've got occupation as therapy, selection, gradation, analysis, and adaptation. So how is occupation as a form of therapy, both as an ends and as a means? Analysis. And on the right side here we've got adaptation, which also covers modification of activities, and evidence as well. Radomski chapter 13 covers learning. So we've not only got different theories of learning here, we've got the definition, human information processing model of learning, clinical considerations in teaching clients. So how are you going to help them learn? We've also got desired learning outcomes, task-specific skills versus general strategies related to expectations for transfer and generalization of learning. And this is very important because we know that our clients are not only going to be performing these skills in a clinic-based or hospital-based setting, but these skills need to be transferred into their contexts and environments outside of the therapy setting. Fundamentals of the teaching learning process, making personal change, and the occupational therapist as teacher. Pedretti chapter 7 is mixed in here, and it is not a random placement, but specifically because this chapter covers teaching activities in occupational therapy. So it ties into that same learning chapter. Teaching strategies in occupational therapy are covered in this concept map, along with the therapeutic use of self, embodying mindfulness in OT, which we know that is important because we are one of the vital tools of caring for our patients. Radomski chapter 6 moves into assessing abilities and capacities in regards to cognition. So this chapter covers the definition of cognition, primary cognitive operations, and this breaks down attention, memory, orientation, so some areas of executive functioning, executive abilities here, the process of cognitive assessment, different cognition assessments themselves, and the self-report measure, measures of functional cognitive performance, and interpreting the results of performance on cognitive assessments. So what do those assessments tell us? Chapter 24 continues on with cognition and ties in optimizing cognitive performance. Let me zoom out just a little bit. There we go. So in this chapter, it begins again with an introduction. Cognitive rehabilitation is covered here. Cognitive rehabilitation approaches. Skill, task, habit training is covered. Strategy training for cognition, memory-related strategies for cognition, task environmental modification training, and that includes the caregivers as well. Cognitive stimulation therapy, process-specific training, speed of information processing training, clinical reasoning in cognitive interventions, client and family factors, which is important in all areas, not just cognition. Outcome expectation setting and anticipated contact time. This is very practical or pragmatic information here. And alignment within the scope of practice, clinician competence, and the interdisciplinary team. Next, we move into another Pedretti chapter. Pedretti chapter 26 is evaluation and treatment of limited occupational performance, which is a very broad topic, but this helps break it down into more specific terms. We've got cognition in occupational therapy, models guiding the practice of occupational therapy, choosing appropriate assessments, and last but not least, on the right over here, we've got managing cognitive dysfunction that limits occupational performance assessments and interventions. So now that we have assessed, what do we do about it? Radomski chapter 5 is where we move from cognition onto vision. And this chapter covers visual impairments, visual assessments. We've also got hemi-inattention versus neglect versus visual loss. We've got specific disorders such as visual processing and deficit and screening, and visual fields and visual pathways, which gives us a foundation for understanding vision. And here at the top left, we've got additional resources. Radomski chapter 23 continues on with vision and moves into the low vision population that you'll be working with. So we've got age-related changes in vision here, and we've got neurological changes in vision, and then interventions for varied visual deficits, assistive tech tools and techniques, visual field deficits, oculomotor dysfunction, and unilateral neglect are specifically addressed. We've got the OT role in the low vision clinic, OT process in low vision, safety consideration when dealing with vision, and again, additional resources. Pedretti chapter 23, this is the visual chapter that Pedretti ties in. We've got evaluation of sensation and intervention for sensory dysfunction here. For this one, we've got treatment of visual perception and dysfunction, roles of vision in the adaptation process, visual field, visual attention and scanning, visual acuity, and the OT role in vision. Radomski chapter 8 moves into assessing abilities and capacities in motor planning and performance. So now we're moving on from vision to motor planning and performance. We've got the reflex hierarchical system versus the system models of control. Evaluations used by neurophysiological approaches, evaluation using the system-based task-related approaches, and then system-based task-related approaches themselves. Moving on to Radomski chapter 21. This one is going to be very useful. It is optimizing motor planning and performance in clients with neurological disorders. So here we've got different approaches and techniques such as Brunstrom's movement therapy. We've got interventions for postural alignment, interventions for motor performance, NDT, the Bobath approach, constraint-induced movement therapy, interventions to improve motor planning, rude and proprioceptive neuromuscular facilitation approaches, motor characteristics of central nervous system dysfunction. So this one covers a lot of techniques for working with patients with neurological disorders. Radomski 22 moves into optimizing sensory abilities and capacities. And in this concept map, there are 4 areas covered: choosing an intervention strategy, desensitization, sensory training, and sensory therapeutic techniques after CVA. Chapter 9 of Radomski covers assessing abilities and capacities in regards to sensations. So we've got peripheral nerves and the peripheral region, along with classification of neuropathies and evaluation and intervention. The last 4 chapters are right over here, just behind the arrow. I'm going to jump back over now that I've opened them up. Pedretti chapter 25 moves into eval and intervention for perception dysfunction. And here this chapter covers behavioral aspects of perceptual dysfunction, general principles of OT eval, general approaches to OT interventions, gives an overview. We've got motor perception disorders, tactile perception disorders, a variety of evaluation and interventions for specific perceptual impairment, such as right-left discrimination dysfunction, visual spatial, visual perception disorders. Pedretti 24 is visual deficits specifically after brain injury. So we've got intervention and intervention approaches up top, the hierarchical model of visual perceptual processing, visual attention and scanning, visual acuity, oculomotor function, and the function of the brain involved. Radomski 7 is assessing abilities and capacities for all patients. So this is a basic breakdown of range of motion, strength, edema, endurance. Radomski 20 continues that same basic breakdown with the neuromusculoskeletal system. We've got some of the foundational materials here, and we've got the biomechanical approach to treatment. So that concludes my final e-portfolio. And again, this will be beneficial to me in all stages of my career as an occupational therapist. Thank you.